जय हिंद। मेरा नाम है अलख पांडे और आज मेरे साथ हैं भारत के बहुत ही जाने माने शिक्षक डॉक्टर रंजीत। और ये कॉलेज स्टूडेंट्स को, मेडिकल कॉलेज स्टूडेंट्स को, डॉक्टर्स को नीट पीजी एग्ज़ाम की या अभी जो रिसेंटली नेक्स्ट एग्ज़ाम आने वाला है उसकी तैयारी में हेल्प करते हैं। बहुत ही बेहतरीन शिक्षक भी हैं और हमारे साथ फिजिक्स वाला के पीडब्ल्यू मेडेड में, जहां हम मेडिकल स्टूडेंट्स को उनके पीजी एग्ज़ाम्स के लिए तैयार कराते हैं, उस हमारे वर्टिकल को लीड भी कर रहे हैं। तो आज इनसे जानेंगे कि एक तो हो गया हमने नीट एग्ज़ाम दिया और हम सब नीट एग्ज़ाम को बहुत अच्छे से जानते हैं, पर हम जानते हैं नीट यूजी को, जिसको क्वालिफाई करके भाई हम एमबीबीएस करने चले जाते हैं। तो क्या एमबीबीएस का एग्ज़ाम क्वालिफाई करते ही इसके बाद आप क्या डॉक्टर बन जाओगे, ये श्योर है? क्या 4 साल 5 साल की पढ़ाई के बाद आप डॉक्टर बनने ही वाले हो? कैसे जर्नी आगे होने वाली है, इसके बारे में हम लोगों ने बहुत कम बात की है। तो आज पोस्ट कॉलेज लाइफ के बारे में बात करेंगे कि असल में डॉक्टर कैसे बनते हैं। सो सबसे पहले वेलकम रंजीत सर।
Thanks a lot, sir. So it's a pleasure to be here, and it's a pleasure to share a place with you and to talk about the journey of a medical doctor, and not just the journey of the college life, how to become the best doctor in whatever specialty you choose. And I think PW MedEd will be a wonderful platform for upcoming doctors, not to train students. Our motive is to train good doctors. So there's a very big difference between training a student and training a doctor. And I feel that with every faculty support and the tech support and the tech content support, we'll make sure we'll train good doctors who will be helpful to the society in the future.
बहुत बढ़िया बात कही आपने, नॉट ट्रेनिंग स्टूडेंट्स, ट्रेनिंग अ डॉक्टर। वाह, देखो भाई कितना बढ़िया सर ने मोटिवेट किया आपको। तो रंजीत सर, मेरे कुछ डाउट्स हैं और हमारे बच्चों के भी हैं, तो उसको क्लियर कर रहे हैं आप कि मान लीजिए मैंने नीट यूजी का एग्ज़ाम लिखा, मेरे अच्छे नंबर आए, मैं एक अच्छे कॉलेज में पहुंच गया, या हो सकता हो अच्छे गवर्नमेंट मेडिकल कॉलेज में या अच्छे प्राइवेट मेडिकल कॉलेज में मैं पहुंच गया। क्या मैं डॉक्टर बन गया हूं, ये श्योर है यहाँ से, या अभी बहुत सी लड़ाई? ऑफकोर्स मुझे पढ़ाई करनी है और एग्जाम से पास होना है, पर क्या कॉलेज में घुसते ही अब ये श्योर है कि मैं डॉक्टर बन जाऊंगा, या अभी भी ऐसा कोई क्वालिफाइंग एग्जाम है जो मुझे क्वालिफाई करना होगा कि मुझे डॉक्टर का एक स्टैंप मिले?
You will definitely become a doctor. Whatever exam comes, I feel that human beings are the most versatile people. Anything you throw at us, we will definitely find a solution for it. Yes, you will become doctors. Yes, it's not going to be difficult when you study in the way it has to be studied. Next, or NEET or whatever exam pattern or name they change, they are going to deal with human beings' medical problems. They cannot create a new disease for an exam. It's a disease which is there for 200 years. I'm going to learn the disease for 200 years. Maybe sometimes we come in a t-shirt, we come in a blazer. That's the difference between NEET or next exam. If I am destined for my end goal, which is becoming the best doctor in my capability, any student who's entering NEET, be it government, be it private, if they can put in heart and soul, they will come out in flying colors and they'll have the stamp of the doctor. Whichever organization is going to put a barrier, they'll definitely come out of the barrier.
वाह, जैसे अभी तो नेक्स्ट एग्जाम आने वाला है, उसके अराउंड काफ़ी कंफ्यूजन भी है, अलग अलग नोटिफिकेशन आते रहते हैं। तो अभी नेक्स्ट एग्जाम से पीछे चलते हैं कि कैसे ये सिस्टम वर्क कर रहा था या अभी भी अगले 1-2 साल कैसे वर्क करेगा। तो जैसे मैं एक इंजीनियरिंग स्टूडेंट की बात करूं, मैं कॉलेज में गया, मैंने 4 साल पढ़ाई की और सेमेस्टर में नंबर प्राप्त किए, और फाइनल सेमेस्टर में नंबर प्राप्त करते ही, रिजल्ट आते ही मैं अपने नाम के आगे इंजीनियर लगा सकता हूं और फिर मैं अपने लिए जॉब सर्च कर सकता हूं। क्या डॉक्टर में भी ऐसे ही वर्क करता है या कुछ डिफरेंस है?
Before next exam, if you take like 3-4 years back, it is going to be, I go to my college, I give my theory exam, I give my practical exam, and I become a doctor, I go and practice. This is for every student who studied in India, be it government or private. But there are students who have studied in abroad, like Russia, like Kyrgyzstan, Kazakhstan, multiple places.
अभी यूक्रेन से भी
Ukraine, multiple places. So once they come to India, they had a qualifying exam called as FMGE, Foreign Medical Graduate Examination. Once they graduate that, they get a degree. That was the difference before next exam.
तो मतलब हमें ये भरोसा नहीं था कि बाहर वो कैसी पढ़ाई कर रहे हैं, हमारे यहाँ तो पढ़ाई हम रेगुलेट कर रहे हैं, तो उसके हिसाब से वो डॉक्टर बन गया है 5 साल में, 5.5 साल में। पर वहाँ के लिए हम श्योर नहीं थे। अच्छा, ऐसा भी है कि वहाँ जो बच्चे का जो पाथ होता है वो 6 साल का होता है, ऐसा है?
It's like India has a curriculum of 4.5 years. Like that, 4.5 years of study and then 1 year of practice, which is internship. 5.5 years total. So every country has their own requirement. Like China, there is 4.5 years plus 4 plus 1 year, 5 year. Russia has a bit of 6.5 years and above. It's different for different countries. The reason why India wanted FMG exam is not because the students are bad, because they have studied in a place. Because when you take diseases, it is localized to different places. Like disease what I see in southern part of India, I might not see in the northern part of India, because it's very, very localized and it's very, very fine. So, but when a student studies from Russia, they will be an expert of the disease there, because they must have seen patients there. The text, everything will be as that of that country. But they're going to come and practice to India. If they're not practicing in India, they don't want to give FMGE exam.
Oh.
So it's that's all. They let's say from Russia, they want to go to US. They give US only exam, licensing exam. So we had, because they are studied in a different environment, different diseases, different places, they have to come practice in India. We have a license. We had a license exam. That's the only difference. Students in India studied in India, learned from the text in India. So I know what happens here. So I don't want a license exam before next exam is going to happen.
इसको मैं रिलेट कर पा रहा हूँ, सही कह रहा है। मैं रशिया में था तो बुखार हुआ था, तो वहाँ वो सैशे मिलता है पाउडर वाला। हम लोग पैरासीटामोल खाते हैं, उनका सैशे होता है, उसको गर्म पानी में डाल के ऐसे पी जाओ, उससे बुखार उतर जाएगा। तो विच वॉज वेरी शॉकिंग फॉर मी। मैंने कहा मैं तो बचपन से पैरासीटामोल खाया हूँ भाई।
So those are the differences. So they have to get used to our Indian way of things. So FMGE was a licensing exam for foreign graduates before next. So once next happens, like the vision of next is to make
नहीं,
sure.
तो पहले चलते हैं। तो पहले अपने फॉरेन मेडिकल जो बच्चे जा रहे थे, फॉरेन मेडिकल ग्रेजुएट जो MBBS कर रहे थे, उनको अगर भारत में आके डॉक्टर बनना है तो आपको FMGE का पेपर क्वालिफाई करना होगा। और क्वालिफाइंग होता था कि मेरिट होता था? वो क्वालिफाई
पास फेल क्वालिफाइंग एग्जाम
कि एक ठप्पा लग जाएगा, हाँ ठीक है, अब आप डॉक्टर बन सकते हो, प्रैक्टिस कर सकते हो किसी हॉस्पिटल में भी और अपनी क्लिनिक में भी जा सकते हो, यू कैन प्रैक्टिस। पर जो भारत के बच्चे थे जो किसी गवर्नमेंट मेडिकल कॉलेज में, प्राइवेट कॉलेज में, भारत के एजुकेशन सिस्टम में पढ़ के डॉक्टर बन रहे हैं, उनको सिर्फ अपना फाइनल ईयर का एग्जाम क्वालिफाई करना है, दैट्स इट।
Finally theory exam, finally a practical exam, and then 1 year of internship. Internship also, like there'll be professors who will be grading them in internship, like a logbook, practical logbook. Once they clear that, yes, they can go and practice or work in a medical college or hospital or any place. They can also set up their own clinic.
अब इसके अंदर जैसे 5 साल बच्चे ने पूरा अपना 5.5 साल पूरा कंप्लीट कर लिया, अब इसके बाद वो डॉक्टर को नौकरी कैसे मिलेगा? क्या वो जाएगा एक सरकारी अस्पताल में या फिर वो प्राइवेट अस्पताल में? ये कैसे वर्क करता है?
Government for every state releases notifications for their state PHCs, primary health center, urban health center. There'll be notification every year. Or there's an UPSC CMS. Like general UPSC, we have UPSC for combined medical services. That CMS, that goes to a central government employment scheme. That's for government. For private, it's more of looking into the ads or going and giving the resume to a hospital nearby. If there's a vacancy, they can fit inside.
Just that's like any other job interview?
Yeah, that's how it's also private.
और अदरवाइज आप सरकार के एग्जाम लिखो और उनके जाके आप इंटरव्यू दो और वहाँ पे सिलेक्ट हो जाओ तो आप सरकारी अस्पताल में भी पहुँच सकते हो। ये पहले का तरीका था डॉक्टर बनने का। फिर ये चेंज हुआ है, अब कैसे नेक्स्ट के आने के बाद से अगर आएगा, और अभी जब तक नहीं आया तो क्या अभी भी यही चल रहा है या अभी भी कुछ और डिफरेंट हुआ है?
Till now, till 2019, this is the same thing.
19 तक सेम?
19 the same. So
19 तक कोई क्वालिफाइंग एग्जाम नहीं है लास्ट में बच्चे के सामने?
No.
सिर्फ उनके लिए है जो विदेश से वापस आ रहे हैं।
Only for them.
भारत के बच्चे ने अगर एक बार MBBS कर लिया तो वो डॉक्टर बन गया है। अब उसकी ये क्षमता पे है, उसकी क्वालिफिकेशन पे है, उसके एप्टीट्यूड पे है कि वो सरकारी अस्पताल में पहुंचेगा, प्राइवेट में पहुंचेगा, और उसकी चॉइस पे भी है कि वो अपनी क्लिनिक खोलेगा। पर 2019 तक यही चल रहा है। फिर
So now the government has released a notification that next exam will be a licensing exam for doctors in India and for doctors coming from abroad. So FMGE exam will not be there in future. That was the exam, the notification's purpose. So be it from foreign or be it from India, the student has to give an exam called as NEXT, which is a licensing exam for them to practice. To put in simple terms, you go into a law college, you get a degree. You cannot become an advocate unless you enter bar council. So like that, you clear it, you might get a degree. But to practice, the license to practice, they have to clear this next exam. And when it's going to get implemented, there are few initial hiccups there. I think the NMC and the health ministry will be definitely laid on a plan, and they will definitely inform all the graduates well in advance. It's not going to be a sudden thing like tomorrow I'm going to have a next exam. It'll be easily 6 months to 1 year before that notice will happen, and based on that next exam is going to happen.
इसमें तो अभी डिटेल में चलेंगे नेक्स्ट एग्जाम के अराउंड, बहुत कन्फ्यूजन है। और इनफैक्ट मेरे जो स्टूडेंट्स कॉलेज फर्स्ट ईयर सेकेंड ईयर में हैं, कई लोगों को तो कुछ पता भी नहीं है, तो बहुत रूमर चल रहे हैं उनके। मैं बात करता रहता हूँ बच्चे से, बड़े रूमर बताते हैं कि हमारे सारे सेमेस्टर से सारे प्रॉफ एग्जाम्स के नंबर को जोड़ा जाएगा, एवरेज निकाल देंगे, नेक्स्ट में 2 एग्जाम है। अभी तो रूमर बहुत सारे चल रहे हैं, इसके अराउंड और डिटेल में चलेंगे। अभी ऐसे बात करते हैं कि एक फर्स्ट ईयर का बच्चा जो कॉलेज में बैठ गया, पहुँच गया है, या हमारा एक फर्स्ट ईयर में बच्चा कॉलेज में जाने वाला है, यहाँ से उसकी लाइफ आगे कैसे जाने वाली है और कैसे वो उस नेक्स्ट एग्जाम को देखे और उसके लिए क्या अभी से कैसे तैयारी करे, थोड़ा इस पर प्रकाश डालें कि कैसे वो अपनी लाइफ को प्लान करें। देखिए, एक नीट यूजी का एग्ज़ाम देखा जाए तो भारत का सबसे ज़्यादा कॉम्पिटिटिव एग्ज़ाम है। टफ तो नहीं बोल सकते, सिलेक्शन तो टफ है ही। अब वो बच्चा किस तरह से लड़ झगड़ के 1 ड्रॉप लेके, 2 ड्रॉप लेके, 3 ड्रॉप लेके कॉलेज पहुंच गया बड़े हाई एस्पिरेशन के साथ। कॉलेज पहुंच के कहीं ना कहीं मुझे जो दिखता है, फर्स्ट ईयर का कॉलेज का बच्चा बहुत ही ज़्यादा डायरेक्शन लेस है, और कहीं ना कहीं वो अपने कॉलेज सीनियर्स की तरफ देखता है कि बताओ अब आगे क्या करना है, कैसे डॉक्टर बनना है। यहाँ तक तो आ गए, क्योंकि 12th में तो यही सपना होता है कि व्हाइट कोट डालेंगे, इंस्टाग्राम पे डॉक्टर लिख देंगे अपना नाम और डॉक्टर बन जाएंगे। बट इसके बाद अब तो असली जर्नी तो अब शुरू हुई है, इसके बारे में थोड़ा बताएं सर।
Okay, so for a student who enters MBBS, generally when they study for 11th, 12th standard NEET UG, they are like little bit of more tension is there, and they crack an exam, they become a bit relaxed. That always happens. It's not for a student. Like if I am going to crack an exam, I'll definitely be relaxed. So most of the time what happens, the first year of MBBS, 6 months goes in the relaxation, happiness phase. So that if they can change, I'm not asking them to read for 5 hours a day. 1 hour a day, consistently for 365 days, enough.
हाँ, बस 1 घंटा पढ़ाई।
That's enough. That's more. But consistently for every day. So when in the first year of MBBS, they have anatomy, physiology, biochemistry.
But this is apart from your classes.
Yeah, apart from the classes, obviously. Right? So they have anat, physiology, biochemistry. So they will be taught, like anatomy deals with the bone, muscle, nerves. Physiology deals with how my heart functions and everything. Biochemistry, when I eat a food, I need energy. How the energy is formed will be by biochemistry. So you will have classes there. You will have practicals in anat, physio, biochem also. So once you come to hostel or your home, just 1 hour per day of what happened that day. That's enough. So this has to be consistent. But most of the students try to read in the last attempt. Just exam has been in December. Okay, I'll read for 10 hours a day. From November, I'll crack the exam. You will do it.
You'll do it, right?
You'll do it. But that's not the concern here. But for the 11 months, I've not been consistent. So intensity is never going to give success. It's the consistency which is going to give success. So instead of putting, if you can put 10 hours for 2 months, why can't you put 1 hour for 1 day?
और ये जो पाप करते हो आप ये फर्स्ट ईयर में, इन सब का जो पाप का घड़ा है, पाप आपको वहाँ पाप का घड़ा भरता है और इन सब का रिजल्ट मिलता है आपको जब आप अपने अभी जो नेक्स्ट एग्ज़ाम आने वाला है, जब आप अपने लास्ट स्टेज पे पहुँच जाते हो, है ना, फाइनल ईयर में, तब आपने कहीं ना कहीं रोट लर्निंग करके एग्ज़ाम्स तो सारे लिख दिए थे, आपको कुछ आता तो है नहीं एक्चुअल में, तो आप एक डॉक्टर तो अच्छे से बन नहीं पाओगे। अभी जैसे नेक्स्ट एग्ज़ाम आ रहा है, तो अब नेक्स्ट एग्ज़ाम के अकॉर्डिंग कॉलेज फर्स्ट ईयर, सेकेंड ईयर, थर्ड ईयर तक के प्रॉफ एग्ज़ाम की कितनी वैल्यू है और उसमें कितने नंबर लाने ही चाहिए?
Okay, just before going to the next exam, we look when at NEET PG. In NEET PG, when NEET PG was there, which is after internship exam, first year, second year, third year, fourth year prof exam, I have to pass the exam.
NEET PG क्या है? समझाएं पहले, NEET PG एग्जाम समझाएं।
So next PG also, when next comes.
NEET PG क्या है? पहले ये समझाएं हम लोग को।
So NEET PG is an exam where once a student becomes a doctor, has the MBBS degree, have to give the exam to choose their specialty. You want to become a surgeon, orthopedician, or a diagnostician,
पर प्रैक्टिस करने के लिए नहीं है
pediatrics. No, it's not for practice.
जैसे आप पहले बताए थे,
Just for it.
2019 से पहले तक ये था कि आपने MBBS कंप्लीट कर ली,
You are
अब आप
ready to
प्रैक्टिस कर
practice.
सकते हो। पर इसके बाद भैया आपको अगर पीजी करनी है, स्पेशलिस्ट बनना है,
MD
तो अब
और
NEET का
MS,
PG
NEET PG
एग्जाम,
exam.
जैसे यूजी एग्जाम देके आपने MBBS किया, अब पीजी एग्जाम
Same.
देके आपको अब फिर
Speciality.
से स्पेशलिटी मिलेगी। स्पेशलिटी के लिए आप कॉलेज जाओगे, पढ़ाई करोगे। अब पढ़ने का तरीका ख्याल अलग होता है पीजी के अंदर, वो अलग बात है। पर वो एग्जाम कहीं से भी आपको डॉक्टर बनने के लिए वेरीफाई नहीं कर रहा था, डॉक्टर आप बन चुके थे। हाँ, तो अब उसके बारे में बात करते हैं।
So for next exam, again university exam will stay as
NEET PG के बारे में पहले
NEET PG. Okay, after you finish your NEET PG, you get your scores. Based on your scores, based on your interest, you either do an medical field, that is MD, surgical field, which is MS. Like ophthal is surgical field, ENT is surgical field, gynecology is surgical field. So that all comes under MS. MD like normal general medicine, pediatrician, your lung medicine, all these comes under MD. So you either choose MD or you choose MS. That's what they do after NEET PG.
Do students actually choose it, or is there a choice with them, or their marks decided?
To be frank, there are quite a few students who are choosy. They do because let's say like when I was in MBBS, choice is never mine. Choice is I would have had some teacher who is amazing. I would have had some teacher who impressed me in that field. That is my choice. So it's totally dependent on, yes, the student is also important. At the same time, because you can, a good teacher can make even a boring subject very, very interesting. If a student develops interest in any subject, not just medicine, they will excel in the subject. So that's what takes me to the field. I'm getting impressed by a surgeon. I wanted to become a surgeon. It's a dream. So they do happen. So yes, mark do decide a lot.
मेरिट भी तो होती होगी,
merit do decide a lot.
सबसे ऊपर क्या मिलता है जैसे?
So the first rankers generally prefer radiology, which is like CT scan, MRI interpretation.
सबसे toughest है उसकी सीट क्रैक करना। और कितनी सीट होगी भारत में लगभग?
Around maybe 1,000 and not.
तो बस 1000 सीटें हैं। और इसके बाद क्या आता है?
So dermatology. So most of the specialty, the number of seats is around 1,000 to 3,000. That's all. So we have close to 19-20 specialties. So the total number of seats comes, including government as well as private, comes around 40-45,000, not more than that.
और हर साल हमारे ग्रेजुएट निकल रहे हैं?
Around 1 lakh.
तो हर कोई पहले साल ही निकल के स्पेशलिटी कर पाएगा, इसकी गारंटी नहीं है?
As of now, no.
Wow. So they have to practice. For the time being, keep practicing and keep trying for the PG exams.
Try for the exam and once you clear the exam, you go.
ये statistics तो बड़ी टफ लग रही है मुझको फिर। 1 लाख बच्चे ने इस साल क्वालिफाई किया, अगले साल 1 लाख बच्चा और आ गया, सीट्स 40,000 है, तो लगातार एक बच्चे का चंक तो बनता जा रहा है जो पीछे छूटता जा रहा है। So lots of doctors are not able to qualify the PG exams. Does this happens?
Yeah, if you take the statistics, last year NEET PG exam, close to 2 lakh people wrote the exam. For a seats in the range of 45 to 50,000. Maybe the seats are increasing every year. We project this year I might have an extra 8,000 seats, but again one day when the counselling schedule comes, we'll be able to know.
और इस टाइम ये MBBS करके बच्चा कर क्या रहा है? तैयारी कर रहा है या प्रैक्टिस कर रहा है?
It depends totally on the person. Like if the person is financially independent, they can just go and read. Like when I did my MBBS, post MBBS, I was working as a night duty doctor. And in the morning we used to read. We used to go to the library, sit there and read. So it's totally dependent on them. If they have a good family support, where they can sit for 1 year completely just reading, they read. But there are quite a few chunk of doctors who prepare as well as who work simultaneously. There are like less intensive jobs. Night duties are not that intensive in most of the hospitals. A hospital like AIIMS Delhi, very intensive. But yes, obviously in few hospitals where I just need to take care of few patients, less intensive, do the work, take care of the needs and also you study.
जैसे बहुत सा बच्चा कॉलेज जाता है, उसको तो यही सपना है ना 5 साल बाद नौकरी मिल जाए, कुछ पैसे की नीड भी तो होती है, तो वो फिर जॉब कर सकता था, ये चल रहा था। और जिसको आगे स्पेशलिटी अपनी करनी है तो वो नीट पीजी का एग्ज़ाम लिखे और मेरिट में आए और निकल जाए। पर ये श्योर है कि 1 लाख में से 20-25 हज़ार बच्चा ही मेरिट में निकल सकता है। और हर साल ड्रॉप वाले बच्चे भी आते जा रहे हैं, वहाँ भी ड्रॉप वाला ट्रेंड चल रहा है। कितने अटेम्प्ट्स थे नीट पीजी में?
No number of attempts.
तो क्या ऐसा भी होता था कोई 45 एज का डॉक्टर भी लिख रहा है ऐसा?
There are like I think 2-3 years back there was a person who was around 50 years cracked NEET PG.
So this is common there.
This maybe a rare thing.
This is rare, but
50 is rare. Most of the students when you finish a doctor profession, it's not always that every student is going to go to MD or an MS.
अच्छा.
I have primary health centers. There are huge number of primary health centers in the country. So they become doctors there, they practice there, they grow there.
अच्छा, फिर वो कभी स्पेशलिटी नहीं लेते?
They might go, they might not go. So this is not the only route. The student always thinks that this is the only route for me. You can put up a clinic. It's MBBS. It's Bachelor of Medicine and Bachelor of Surgery. So when you can go and practice, you should have just the confidence. You can treat it. Yes, I might not be as good as neurosurgeon to do the brain surgery, but I'll be as good as diagnosing what is the problem in the brain with MBBS.
But मेरे को एकदम नहीं पता है, तो मैं एकदम अपने बच्चों की तरफ से एकदम सवाल एकदम खुला पूछ रहा हूँ। क्या अगर किसी ने MBBS कर रखा है, क्या वो सर्जरी करने के लिए अलाउड है उस समय पे?
During MBBS, yes, during training period, we are allowed to do few steps of the surgery under supervision.
नहीं, after MBBS when you
after MBBS alone you can't do a surgery. There should be a surgeon or that specialist should be there. I can assist to some extent. As an MBBS, I'm not allowed to do a surgery. Yes, I can diagnose it. The surgeon should do a surgery.
लेट होता है सर्जरी होने में, टाइम लगता है। मतलब ओवरऑल आप देखें तो मेडिकल सिस्टम इसलिए पीछे छूटता जा रहा है हम लोग। डॉक्टर्स कम है, स्पेशलिस्ट और कम है, फिर सर्जरी की एक पर्टिकुलर डेट आएगी और सर्जरी करने के लिए एक MS की जो रिक्वायरमेंट है ही है। उसके बिना आप एक MBBS सर्जरी कंप्लीटली इंडिपेंडेंटली
cannot do it. That's why my country is trying to increase both MBBS seats as well as the specialty seats. So maybe in future I'll be able to fill the gaps wherever it is there.
ये चीज़ें चल रही है 2019 तक और 2019 तक ये एग्जाम नीट पीजी का होता था पोस्ट इंटर्नशिप
एंड
अनलिमिटेड अटेम्प्ट्स। हर साल एक बार कि 2 बार?
once a year.
वंस अ ईयर, एक ही बार अपॉर्चुनिटी मिलेगी। अब नेक्स्ट आके कैसे गेम बदल सकता है इसका?
Okay. So next comes, still there is not much of clarity on when it is going to happen. There's a little bit of difference of thoughts here, but let the government will definitely clarify in coming times. When next comes, as of now, what the Gazette says, as per the laws, next is going to happen in the final year of MBBS. It's going to replace the final year of MBBS theory examination.
अच्छा, 4th ईयर वाले
Theory exam.
Prof exam
Yeah.
की जगह।
This is as of now on July 13th, 2023. So in future, it might change, it might not change. So as of now, in the Gazette says, the theory exam of final year is going to be replaced by next exam. It's uniform for every doctor in the country. So there will be no theory exam. Instead, you give an MCQ exam. The practical exam still stays there. So instead of having an objective way of testing, I'm subjective way of testing, I'm having a pure objective way of testing. So it's MCQ, so it's right or wrong. Handwriting will not matter. Presentation will not matter. Colors will not matter. Qualified? Yes. Not qualified? No. So that is a welcome step. So now, because then most of the students in MBBS, if someone is listening, they can easily relate. Our goal in university exam is to write 50 pages.
50 pages.
So that is like set forever. My seniors say that you don't know something, write 50 pages, you will at least get the 50% mark. That might not happen here. So here, you know it, you get it. So it is, because medical field is so dynamic, I can explain a disease in 10 pages, but I can put the points required in the disease in 1 page also. So the presentation should not alter or should not differ a student to get a seat of an MBBS or a degree of an MBBS. So this is more of an MCQ exam. So it's a very good exam. At least what they have projected till now, what it happens. Implementation might have some hiccups. I think the government will definitely take care of that. It's a very good exam if it comes.
But with next coming in, अब आप MBBS करने के बाद भी you are not a certified doctor जब तक आप next qualify नहीं, ये change आ रहा है।
Yeah.
ये ऐसा क्यों? इसके करने के पीछे क्या कारण रहा होगा?
The reason is like I said, there are different universities. Every state in our country has universities. So every university has a different exam pattern. So if you look at NMC, 3 years back, they produced something called as CBME curriculum. That is uniform across every country from 2019. So if you enter MBBS in Kanyakumari or in Kashmir, the curriculum is the same. That's what the first step for the next is. Before that, the curriculum also is different.
अच्छा.
Subjects are same, curriculum is different. So the teaching pattern, the number of hours for teaching, everything was different. So once
standard books भी अलग थी?
No, books will not change. But let's say that a university has like 80 hours of theory teaching, 20 hours of practical teaching. Some other university might have 70 hours of theory teaching, 30 hours of practical teaching. There might be a little bit of change.
Marking scheme भी थोड़ी बहुत अलग होती है?
Marking schemes, exam schemes also a little bit changes. Like some university exam might have MCQs, 2 mark, 5 mark, 10 mark. Some will have only 2 mark, 5 mark, 10 mark, no MCQs. So there's a difference there. So from 2019 onwards, the NMC is trying to put a CBME curriculum. So the curriculum is uniform. That's the first step of next. So once my curriculum is uniform, next is exam. So everyone has studied the same curriculum. So let me have a uniform exam. So my curriculum is same. The number of teaching hours is same. What is to be taught is same. The way of integration, like anatomy and surgery, can be integrated. That is same. So the exam also should be same. That's the logic of next exam. There are lots of fear among students that will I be able to clear next exam? That is definitely there. Whenever any exam pattern changes, for NEET UG also when it was introduced, there's lots of struggle. But now students are getting 720 on 720. So it's that transition period will have anxiety for sure. And we are here to reduce the anxiety, not to increase it.
तो ये जो नेक्स्ट एग्जाम है, अब इससे आप स्पेशलाइजेशन भी कर सकते हो,
क्वालिफाइंग और लाइसेंसिंग
एग्जाम कह सकते हैं कि अब आप डॉक्टर बन गए हो भाई। पैटर्न कैसे चेंज हुआ है नेक्स्ट एग्जाम का? फेज 1, फेज 2, अभी बहुत क्लैरिटी तो नहीं है, रोज नए नोटिफिकेशन आ ही रहे हैं, फिर भी थोड़ा सा आप बताएं।
So next exam, like I said, theory exam of finalists replaced to MCQ exam. So that is next one exam.
फाइनल का प्रॉफ एग्जाम की जगह
MCQ exam, that's next one exam.
Complete MCQ.
Complete MCQ exam. So it's going to be 3-day exam with gap of 1 day, so total 5 days, and morning and afternoon. So that's how the exam has been arranged. So total of 540 MCQs is the pattern which has been released. Might change, might not change, but that's what they have released. 5-day exam with a gap of 1 day, so totally 3 days exam, morning session and afternoon.
फाइनल का सिलेबस क्या फर्स्ट सेकंड थर्ड ईयर के सारे सिलेबस को मिला के होता है?
No. This final year exam will be of medicine, surgery, OG, pediatrics, ENT, ophthalm. These are the final year subjects.
तो मैंने जो फर्स्ट सेकंड थर्ड ईयर में पढ़ा कहीं ना कहीं नेक्स्ट उसको टेस्ट नहीं कर रहा है.
It will be in an integrated fashion. I'll give you an example. Let's say a student wants to treat a patient with heart attack. That comes under medicine. This ECG is what I identify heart attack. Without knowing the vessel anatomy, I cannot identify which vessel is blocked in ECG. So that is more important for me. So that's where integration comes. So once I know anatomy, let's say there's a surgeon being done. Surgeon puts a incision here. If you don't know what vessel comes here, you cannot cut it properly. So though the exam is the clinical orientation, it's like fourth year. First 3 floors are my first year. If I want to jump from the 4th floor, you cannot do it. So you have to read them. Maybe not facts, but the relevance.
अच्छा.
Because I don't want facts. Why should I want my doctor to know 100 facts? If my doctor can say this artery comes here, if I cut, it will bleed, so I don't cut. That's enough for my doctor. If a doctor knows there are 20 vessels in my heart, one vessel is never involved in disease, I need not know the vessel. Just for an example, right? So the next exam will have an integrated fashion of questions which will test their expertise and their ability to correlate the basic sciences.
ये नेक्स्ट का फेज 1 है कि
Phase 1.
ये क्वालिफाई कर लिया फिर.
So if you qualified phase 1, then you go to internship. So in internship, you complete the 12 months of internship based on different.
मेरा कॉलेज श्योर हो गया फेज 1 क्वालिफाई करने के बाद? नहीं.
No, you will do the internship in the college. Same thing. So once the internship is over, they have proposed something called next 2. So what next 2? The initial proposal is, you have done like the NMC has a guidelines of a doctor should know these basic skills, like intubation. If someone is just lying down on the floor, when I go, how do I take care of them? I look at the pulse. There's a protocol. So these are the things which are going to be tested in next 2. Again, the preliminary thing what they told us, they will give case scenarios to judge how you're practicing and what you're writing. They'll have something called an OSCE pattern. OSCE is, I cannot have every case scenario. Every patient might not be available in that day. So I have a template. Say this is the patient details. What's the next step you do? So that's an OSCE pattern. The third, if possible, they'll introduce mannequins. Mannequins are dolls.
ये clinical study type का paper
That is for the OSCE thing. So mannequins are dolls. So you must have seen in various videos, there'll be a doll where the doctors will be practicing CPR. So that CPR practice requires expertise. I cannot press hard, it breaks my bone.
Right.
I cannot press very superficially, it will not have the effect on the heart. So that mannequin tells me how deep I have to press, because that has been programmed. I have to intubate, that has been programmed. So this is the vision of NMC to have next exam. So they are theoretically qualified, they are practically ready. So once they are ready to treat patients.
कॉलेज क्या डिसाइड करेगा? नेक्स्ट 1 डिसाइड करेगा कि नेक्स्ट 2 डिसाइड करेगा कि कौन सा कॉलेज मिलने वाला है मुझे पीजी के?
नेक्स्ट 2 will be as of now by the college. Next 1 will be by central board.
मेरिट किससे बनेगी? 1 2 को मिला के? 1 से. 2 is just qualifying.
Because it's college based. So if it's only when it's uniform, central based, I can use them for merit for anything. College based can any be skewed.
और नेक्स्ट 1 से मेरी मेरिट बनेगी.
Next 2 is no marks, it's just qualified, non-qualified, that's all.
और अभी क्या नोटिफिकेशन आ गया? अभी आप बता रहे थे थोड़ी देर पहले कि फिर एक नोटिफिकेशन आया जस्ट अभी.
NMC has released notification just few hours back saying that whatever they announced for 2019 batch next, because the chairman had a webinar and he said that whatever been announced so far is deferred until further notice by the ministry. So we'll have to wait and watch when they're going to implement and how they're going to implement it. But one thing is sure, the country is moving in the direction of making a license exam. So next will happen. So students who are entering MBBS first year now should not be of the hope that no, I will still give NEET PG. That will not be there. It will be next exam. When? How is the question?
नेक्स्ट आएगा नहीं आएगा? आना चाहिए वैसे, आप जो कह रहे हो आएगा ही. और नीट पीजी, मैं तो ये फर्स्ट ईयर सेकंड ईयर बच्चों को पकड़ता हूँ. इनको बताओ, इनको सर क्या करना चाहिए? ये तो अभी नेक्स्ट की बातें बहुत कर लेते हैं अपने हॉस्टल के अंदर, ठीक है, और फिर पंचायत करके सो जाते हैं. इनको असल में क्या करना चाहिए फर्स्ट सेकंड ईयर में?
See, first and second year need not worry about it. Let them do their work, what they have been doing. Because there is a lot of anxiety that the next exam is going to be a difficult exam. I will start reading ENT from first year. You can't.
अच्छा.
When you don't know what is there in eye, nose and throat, you cannot know the diseases. I'll read surgery from first year. When you don't know about nerve and artery, you cannot read surgery. So first and second year is for the foundation. Yes, you can get aligned to solve MCQs. The only thing a first and second year can do is, it's training, it's solving problems. When you start trying to solve problems from first year, I become very good in fourth year. But I cannot do what I do in fourth year in the first year. First year, I read anatomy. I solve tiny complex problems with anatomy, physiology and biochemistry. When I come to second year, you read about drugs, pharmacology, organisms, microbiology, and the disease, how the disease happens, pathology. So in second year, they will be much more refined. And in second year, the first half of their college, they go to hospitals.
Yes.
So they get exposed to the patients. They have the fact, they can correlate, they can solve a little bit complicated problems. When they come to third year and fourth year, they can really know what to treat and how to treat and finish the curve. It's a circle. I cannot do one thing and complete a circle. So you have to slowly build it, and they have to start. It's a good thing for a doctor. You're going to start solving problems. It's something which should excite you. Our goal is to solve problems in future.
फर्स्ट ईयर में बात करें तो हम लोग अपने आप में फर्स्ट ईयर में कितने घंटे पढ़ाते हैं रोज?
So we have different things. The live lectures, we go as per the CBME curriculum by the NMC. NMC has designated like there should be 100 hours of lecture for anatomy with 20 hours of practicals. The same way we are going.
तो जो उनके कॉलेज में चल रहा है आप उतना ही लेक्चर आप भी उठाते हो?
Yeah,
exactly.
Same. So because since the curriculum is uniform, we follow the same curriculum. This has to be taught to an undergraduate in first year by CBME by NMC.
तो हमारे फर्स्ट ईयर में दो तरह के प्रोग्राम है, लाइव और रिकॉर्डेड.
Live as well as recorded.
कैसे डिफरेंट है?
Okay, recorded is for some like there are students who feel that I can read at my own pace. Like someone wants no disturbance. I read at 12 o'clock in the night or 1 o'clock in the night. I cannot have a live program there. But some students are like, I need guidance. If you guide me in the right way, I'll become a superstar. For the person who feels, yes, I need a guidance, I need a schedule. 7:30 to 9 p.m. is the first year live class. You come and sit there, you learn. And after that, we have DPP, practice. So a student who feels that you need guidance, I would prefer every first year student to be going under the guidance pathway. At least for the start, you need the guidance.
लाइव क्लास का टाइम क्या रखते हैं हम लोग फर्स्ट ईयर का?
7:30 p.m. to 9 p.m.
शाम को क्लास करके आ जाते हैं.
After they can have dinner.
7:30 to
9.
बस
1.5 hours.
रोज की 1.5 hours.
Every day 1.5 hours for the week.
इतना तो पढ़ सकते हो यार तुम लोग, काफी कम है तो. अच्छा आप इतना ही पढ़ा रहे हैं?
Yeah.
1.5 घंटा दिन का.
That's enough. So like I said, it's just they have limited things by the curriculum. If we do that for the next 6 months to 1 year, they can easily clear it.
और बच्चा अगर बैच ज्वाइन करने में देर कर लिया तो फिर क्या करे? किसी को देर हो गई तो क्या ये बैच हर महीने स्टार्ट होता है या एक ही बैच है, कैसे है?
We have an ongoing batch for the previous year students who are already in the first year. So this batch students, when they join, they will most likely join by August first week. Once they join, once they join the first year, they don't start teaching from the day one.
Right.
There's something called foundation course for 1 month. You get used to what happens there. So the classes in most of the college, be it government or private, starts from September only.
Yes.
We'll give them a buffer time to settle. It'll take time for them to settle. If it's a hostel, new place, definitely it'll take time. New state, lots of things will have. So once they settle, around maybe September, middle of September end, we'll have a new live batch for the students. They need not go and do the live batch what is already running because it will be from the half. And they need more slow guidance. So we'll space it as such so that it will be comfortable for them as well.
अभी जैसे कोई फर्स्ट ईयर में है या कोई सेकेंड ईयर में, मिड में है, तो वो कैसे हम लोग को ज्वाइन कर सकता है, कैसे पढ़ाई करे? अगर उसको आज ये वीडियो देख के उसको लगा यार अब मुझे भी तैयारी करनी है तो क्या करे वो?
Okay, so if you're joining in the middle of a course, like I said, there are both recorded and live.
तो ये लाइव वाला रिकॉर्डेड में नहीं जाता, रिकॉर्डेड अलग है पूरा.
The content is more or less the same, but maybe in live
Teachers are same or
teachers are same.
Same teacher.
Same teachers. Content is more or less same. Live might be a little bit more stretched because I can have questions. So I need to address the questions. Interactions will be there. So if you're starting something in middle, like let's say that there are 2 months of class, it's over. So you're starting in the middle. I would say for the 1-2 week, do a bit of an extra work and completed the either recorded portion or the live class also is available recorded for them from the day one. So that anything, but yes, they need to put a little bit of more effort. It will take some time.
अभी तो आप लोग कुछ ऐसा भी चला रहे हैं ना कि लाइव या रिकॉर्डेड में से कुछ एक लो तो दोनों का एक्सेस मिलता है? नहीं,
दोनों.
और ये जो हमारा फर्स्ट ईयर का कोर्स है, ये कितनी प्राइस का है?
So the first year it is 4,999, 5,000, which will have live lectures, recorded lectures, we'll have question bank access where they can practice, and also after the live lectures we have DPPs. So today I've taken 1.5 hours. there'll be like 5-10 questions based on today's lecture. So they can practice as well.
बढ़िया अफोर्डेबल है तो। और सेकेंड ईयर?
Second year, it's 5,500. Again, the same thing, live recorded, DPP is there, and also we have the question bank, we have the test series.
लाइव सीरीज पढ़नी हो लाइव, रिकॉर्डेड पढ़ो, क्वेश्चन बैंक से करना है क्वेश्चन बैंक कर लो, और साथ में डीपी। क्वेश्चन बैंक करना जरूरी है साथ में कि सिर्फ लेक्चर देख के काम नहीं बनेगा? थोड़ा बताएं इसके बारे में।
It is important. Like I said, no, they start developing the skill of solving questions right from the early onset. So from first year, the question bank is aligned like that. In the first year, I won't push them to solve 10-line questions because they won't understand. It'll be smaller questions, smaller problems they can solve. Second year, little bit more complicated problems. Third year, it becomes more complicated. And fourth year, they become ready for the next exam. I would say fourth year student can go with all 19 subjects rather than going for a fourth year pack because they'll have much hold on everything else. That is 9,999. Again, it's an entire course of the live recorded test series and question banks and DPPs.
That's great. ये काफ़ी इन्फॉर्मेटिव था। रंजीत सर, नीट पीजी की तो हमने बात की, नेक्स्ट की बात की, मेडेड के ऐप के बारे में भी बात करने लग गए हम लोग। बच्चों को भी पता चले कि एक्चुअल में क्या कोर्स है, क्या मिल रहा है। बहुत कन्फ्यूजन भी रहती है, बच्चों को पता नहीं रहता। आपके बारे में थोड़ी बात करते हैं। टेल अस अबाउट योरसेल्फ। पूरे इंटरव्यू में आप इंग्लिश बोल रहे थे, दैट डेफिनेटली मीन्स कि आप हमारे नॉर्थ बेल्ट से नहीं हैं। तो आप बॉर्न एंड बॉटअप कहाँ से हैं? व्हाट लैंग्वेज यू स्पीक? व्हाट फैमिली यू आर बॉटअप? वेयर डिड यू हैड योर प्राइमरी एजुकेशन एंड ऑल दैट?
Okay. Yes, I am from the southern part of the India. I am from Tamil Nadu. My dad was working in a bank. So from first to sixth standard, I studied in a school in a town called Tuticorin, which is in Tamil Nadu. Tuticorin.
Tuticorin.
Yeah, in Tamil Nadu. And from 7th to 12th standard, I studied in a town called as Nagarkoil, which is close to Kanyakumari. So that district, that's where I studied. So from there, I moved to Chennai for MBBS. I did my MBBS in Kilpauk Medical College.
ये कौन सा ईयर था?
2006 to 2011. That's my MBBS thing. And after MBBS, I finished the internship as usual. For us, it was NEET PG. I was the first batch of NEET PG.
अच्छा.
So before me, it was AAPGMA. So I can really relate to their struggle because when first batch of NEET PG was introduced, it had 15-day exam. Morning, afternoon, different papers, 30 different papers. So that's how it started. So these students might not know
15 दिन, सुबह दूसरा एग्जाम, शाम को दूसरा एग्जाम.
But it will be allotted differently. You enroll, you will be given a choice. Okay, you have this day. You go and given that day.
15 days are not consecutive.
Not for it's for different people.
अच्छा.
Like I have 2 lakh people. Like some of them write in the morning of one day, some of them write in the evening of one day.
Okay.
So it's a random allotment. So then they said that this random allotment is not working. Let's make it a one-day exam. So they refined. So whatever happens, they'll implement. It's not working out, they'll refine. So the first batch of NEET PG, and that time it was NEET PG was there, AIMS was there, JIBMO was there, and PGA Chandigarh. It had different exams. It's not one exam, it was very different exams. So I wrote JIBMR exam, I qualified JIBMR exam, and I went to JIBMR Pondicherry, where I did my PG in pathology.
आप बहुत इंट्रोवर्ट थे बचपन में, ऐसा कुछ था? कम्युनिकेशन में आप इतना इवॉल्व नहीं थे, एक्सपर्टीज नहीं थी कम्युनिकेशन में, काइंड ऑफ इंट्रोवर्ट पर्सन, ऐसा सच में था? ऐसा लोग बताते हैं.
Though an introvert, I would say like my school was before 2005. Maybe I can say before the era of internet. It was way back. I still remember me seeing my result in dial-up connection. It rolls and we have to wait for the result to come. So in that era, when the communication and the exposure is not that much like this, when I did my entire thing in my second tier city, I was never exposed to things what's there in metro, be it opportunities or be it anything here. So for me, coming from a second tier city, my only job was go to school, read, come back. I do play, but obviously you know that most of the parents say that after 10th standard, cut the play and go and study. So till 10th standard, I play. After that, everything went away. It is 11th and 12th standard is only books. So go read at the school, come back and read. So for me, I was a good student. I can read, I can write an exam. Communication is something which will not be developed when you are in a very close network. That way, especially English. When I come to Chennai, it's a totally different thing. So Chennai is metropolitan. So in Chennai, even though there are lots of people who are auto drivers can speak in English in Chennai. So that was a huge difference for me. When I came there, it might be right or wrong. They don't care about the right or wrong thing. They can speak. I might know the right tense because I did well in my 12th standard English exam, but I cannot speak. That was a challenge which I faced in MBBS. Especially, I still remember my Viva. We didn't have school day Viva. School day was just a theory exam. Practically, you come outside.
कभी वाइवा नहीं हुआ स्कूल में?
It is not there. We just need to do the practical. If the chemistry exam is right, they give marks and they leave away. Maybe Viva was there. They didn't much emphasis on that. They just ignored that. So when it came to MBBS,
कॉलेज में तो बहुत गंदा वाइवा होता है.
yeah, and those teachers are very, very serious.
हॉरिफाइंग वाइवा होता है कॉलेजेस का, बहुत डर लगता है भाई. फिर
So for me, I still remember the few Vivas initially attended. I know the answer. I couldn't talk back.
अच्छा.
So I was always a good student. Even now, I read for 1 hour a day. Whatever advancements comes, so reading has always been something ingrained from me from childhood. So I still read. I read everything. The theory exam of that anatomy, I think I scored around 75%. That's a very good percent for an MBBS. We cannot expect 100 out of 100 MBBS. So if your UG student want to come to PG, please don't expect 100 of 100. No one is going to give. That will never happen here. So in MBBS, distinction itself is like, wow, great. 75, 70%, it's wow, great. So theory exam was good. So I remember my anatomy HOD asking a question Viva. In Viva, what happens is they give a bone to us and ask us to identify what bone, which side of the bone it is. Because every side has some unique markings. And they ask what muscles are attached to the bone. These are the things which happens in Viva. So she gave me a bone. I looked at the bone. I know everything. I couldn't say. I told this bone. I didn't open my mouth. I didn't say a single word. She asked me what's your name. I stared at her. I didn't even say my name. She said, get out. So that's the first experience for me. Okay, for me, communication is something which is really important. It's not just that I know things. I need to make sure my examiner or my patient knows that I know things.
As a doctor, it's very important.
Yeah, it's very, very important. So that was my first, I would say, my first hit in my academics. Till the time, I had amazing teachers. I was very, very lucky to have amazing teachers from my school days till my college days, be it UG or PG. So teaching, making me understand, they did an amazing job and I did what a student has to do. But this communication was not taught to me. Communication is something which has to come on your own by interacting with multiple people, where metropolitan students excel in it. Right. Because they interact. So this communication, I asked my senior, I still remember the senior, I still am in touch with the senior, I asked him what to do. He said, communication is the problem, right? Go and speak in front of mirror every day. Still, before going to live class, I go to a mirror and speak. Everything is about the first 2 seconds. Your hello bachcho, that links. The first 2 seconds is very, very important. So for me, the first 2 seconds, I should break it. If I break the 2 seconds, after that I get into the flow, because the first 2 seconds is not academic.
Right.
Once I come to my academic, I am the king of my academics. So I definitely know that. I definitely know how to take the flow. So that first second, I need a break. So even now, before every lecture, I go and talk in front of the mirror, I blabber something, sing a song, something. So I need to get loosened up a little bit. So that definitely, even before this interview, I'm changing dresses, I spoke something.
Oh.
So that breaks out of my comfort zone, come into it, and once it comes into it, yes, from that onwards, obviously it takes its own flow. So that was my problem with communication. It's a problem. Every problem has a solution.
वो स्टैटिक फ्रिक्शन होता है फिजिक्स में ना, उसको ओवरकम करना पड़ता है बॉडी को चलाने के लिए. एक बार वो क्रॉस हो जाए तो फिर डायनेमिक फ्रिक्शन लगने लगता है, जो कि कम होता है, तो फिर भागने लगती है गाड़ी.
Since you came to physics, I have a question for you. I have seen your series of in the Amazon web series. You're told why pi. Why Einstein and not Newton?
Why? Controversial question. न्यूटन की अच्छी बना नहीं पा रहा था वो, तो अभी ये खाली है ना न्यूटन के लिए. अभी इस पे तो फिर बहुत क्वेश्चन है. व्हाई नॉट टेस्ला? सो टेस्ला इज नील बोयर, सो लॉट्स ऑफ देम आर माय फेवरेट. व्हाई आइंस्टीन हैपेंड फर्स्ट? हमें लगता है ये जो भारतीय बच्चे हैं, हम सबको आइंस्टीन और न्यूटन का एक्सपोजर ही ज़्यादा है, कुछ बाकी साइंटिस्ट का एक्सपोजर कम है. और इसका रीज़न मुझे लगता है करिकुलम है. हमारा करिकुलम अपडेट नहीं हो रहा है, तो घूम फिर के हम लोग बार बार वही न्यूटन के लॉज पढ़ रहे हैं. और आइंस्टीन को पढ़ना भी चाहिए, खैर मास लेवल पे इन लोगों ने बहुत प्रॉब्लम सॉल्व की है. फिर क्वांटम फिजिक्स के साइंटिस्ट का इतना नाम नहीं हुआ ना. आप देखो मैक्स प्लैंक के बारे में कितना ही बच्चा भारत में पढ़ता होगा, नील बोर के बारे में कितना ही पढ़ता होगा, टेस्ला के बारे में भी आप देखो तो कम ही पढ़ाया गया है. तो वही है कि अब जैसे हिस्ट्री किताबों के अंदर धीमे धीमे सिलेबस को अपडेट कर रहे हैं, तो साइंस में भी करना चाहिए, तो आएगा. तो हम भी उसी जनरेशन से पास हुए. अब न्यूटन आइंस्टीन को न्यूटन में बना नहीं पा रहा था इतना अच्छा, तो आइंस्टीन की अच्छी फोटो मिल गई तो बना ली. अब नेक्स्ट डेफिनेटली न्यूटन भी बनवाते हैं आप. उसके बाद मेरा टेस्ला का भी मन है, पर फिर बॉडी भर जाएगी. अच्छा, गोइंग टू आप मेरी फिजिक्स पे मैं आपके पढ़ाने पे मैं भी आता हूँ. तो द टीम was telling me in the beginning only कि आप 2 घंटे से लंबी क्लास नहीं ले पाते.
Yeah.
There's some neurological problem. What's that?
You most of them must have seen Tare Zameen Par. There's a disease called as dyslexia. So if you look at the Tare Zameen Par, when the kid wants to write, lots of things, the animation flies, right? So dyslexia or these all comes under a disease spectrum called as learning disabilities. So dyslexia is a type. I have a problem called as dysgraphia. So dysgraphia means like when I concentrate on anything for beyond a certain limit, fatigue sets in. When fatigue sets in, my writing becomes errors. Graphia is writing. So dysgraphia is abnormal writing. When I say abnormal writing, it's like the spellings, as simple spellings as possible. Like if I have to say left, L-E-F-T. So for me, L-E-F-T will not come, it will come as L-E-T-F. So that's an error, that's a glitch for me. So since most of the NEET PG, we draw flowcharts so that student can understand that. So this for me, if it's beyond 2 hours, I tend to make more errors. Doesn't mean that I don't make errors in 2 hours. I make errors. I erase them and I rewrite them.
No, but you made errors in first 2 hours also. That's also because of this particular thing, or that's a common human error everyone does?
I would make more errors than any normal human being because it's a learning disability. It's a learning disability. It doesn't have any treatment. It's not such a huge difficulty. It's something which I can correct. It's something which I can correct. I erase it and write it back. And these errors will not be in complicated spellings. Tiny simple spellings, which I'm used to. Even if I keep on doing something, if I write my name also, I might make a spelling mistake. I know it's the right spelling here, but this doesn't, my hand maybe not listening to
आप लोगों को वहाँ तो बहुत complex
words
होते हैं जहाँ पे different
that I won't have a problem.
वहाँ नहीं होगी.
That I won't have a problem. See, because it's conscious. These spellings, I need not think about it. It comes routinely. So whatever comes routinely, I have a little bit of difficulty in that. That's why I say that more than 2 hours, I feel that no one should take a lecture. That's my opinion. Because students cannot listen for more than 2 hours.
कब हुआ आपको realize कि ऐसा है आपको?
I realized this when I was giving exams in medical college. Till UG, till my school days, it is fine. Because school days, you know what you are going to write. By default, every definition was in the fingertips. But when I came to medical college, like I said, I cannot remember, no one can remember entire medicine. I know a little bit of medicine and I formulate something and I write the exam. So once I have to do that, my brain has to be, every doctor's brain has to be constantly working and I have to put that in the paper. So once I started doing these things, I had few spelling mistakes, which is actually noticed by one of my teachers. My teacher told, why did you make mistakes in this? That was in the first year of MBBS. No one knows what is it. So when I came to final year of MBBS, where we have neurology and we have psychiatric people, where we went to the posting, when we learned that, then I understood, okay, this is actually a problem. Till the time, because for a doctor in first year, I don't know more complicated diseases. It's a problem, can't do anything. There are few grades. Fortunately, I'm not in the worst grade possible. So it's going so far so good, and I hopefully it will go forever good as well.
So are you treating yourself as well as a doctor?
For this, I cannot treat. Honestly, I don't treat any person because I'm in the diagnostic setup. If I feel sick, I go to a specialist. I tell this to every doctor possible. You need to know what you're good at. Because my patients is trusting me and coming. Even my mom and dad is sick, anyone is sick, I'll tell them to go to the specialist. Because that specialist any day has more importance than a general person. So I am good in diagnosis. You must have had real-time PCR for COVID test. I do that PCR test. That's my thing. My interaction with patients is less, but yes, I do genetic testing. PCR comes under genetic testing. Any DNA-related testing we do. I was diagnosing cancers. This was my domain after my MD, my specialization of pathology.
Why you became a doctor yourself?
To be honest, MBBS, I would say it was more 11th standard. I was not that like these days students, I have to crack NEET exam. I was not that. I was a good student. I used to get marks. I had a uncle who was a gynecologist. He practices in Chengalpet. He was the dean of Chengalpet Government Medical College and he got retired. So growing up, he was the only person who I can connect to a doctor. Like whenever I go to his home, everyone comes and like gives him special treatment. Like, okay, so doctor something has something special treatment because he is a very, very hardworking person and he wanted to become me also to become a surgeon, which I didn't become. So that's when I said, okay, I took the Maths and Science group together. I scored approximately 100 rank in my TNPG in medical, and my score for Anna University was 300. So I could have gone to both. And fine, I had something who can guide me in that direction, so I took MBBS. That was the reason for becoming MBBS. It's not like fire in the belly to become MBBS. Yes, I wanted to have something of what my uncle had, and yes, I went into MBBS because I had good marks. That is really the truth for becoming MBBS doctor.
Then you became a teacher.
I did become a teacher, and I chose pathology. That was a different thing as well. The reason for me for becoming a teacher is I always believe that there's no poor student.
There is no
poor student.
Poor student.
Student is always student. If they get a good teacher, they are a good student. If the student doesn't want to learn, that's a different category, and I can say maybe 5% of them don't want to. Rest 95% of them, if they get a good guiding source, they will learn. And I feel that education is something which can uplift the entire country.
A lot of times when I go to some of my offline center or somewhere, and doesn't happen always, rarely, they say that this particular class is not performing well. I meet students and I meet teachers and I ask them, what are your grievances? मैं टीचर से मिला, किसी विद्यापीठ में गया और मैंने पूछा कि भाई आपकी क्या दिक्कतें हैं? बोलते हैं अपने पास बच्चा अच्छा नहीं आया है। मैंने कहा अच्छा बच्चा क्या होता है ये बताओ, वो फीस दे के आपसे पढ़ने ही तो आया है। सो ये मैंने काफ़ी टीचर्स से कहते हुए सुना है, बच्चा बहुत कमज़ोर आ गया है मेरे पास, हमारे पास कोई अच्छा बच्चा नहीं है। तो जो आपने बोला मुझे भी लगता है 95% बच्चा तो कहीं ना कहीं सीखने ही आता है, वो अपनी तरफ से अटेम्प्ट मारता है। हाँ, आपका पहला 10 दिन, पहला 15 दिन या पहला 1 महीना टीचर का जो है वो डिसाइड करता है कि आगे वो कितना मोटिवेटेड रहेगा, क्योंकि अगर उसको 15-20 दिन में ये रियलाइज़ हो गया ना कि ये मेरे लायक चीज़ ही नहीं है भाई, दिस आई कैन नॉट अचीव, देन ही गिव्स अप, फिर उसका वो पूरा एक एकेडमिक सेशन उसमें चला जाता है। सो आई ऑल्सो बिलीव देयर आर नो पुअर स्टूडेंट्स। हाँ, किसी की जो प्री रिक्वेस्ट नॉलेज है वो किसी के पास कम होती है, किसी के पास ज़्यादा होती है, और फिर यही तो हम लोग का काम है कि ऐसे ना हमारी माताश्री बहुत सही चीज़ हमको बोली थी। तो हमारी माताश्री यही बोली थी कि देखो अच्छे बच्चे को हर कोई पढ़ा सकता है, जिसको कुछ नहीं आ रहा है ना उसको जो पढ़ाए वो बेहतरीन टीचर बन सकता है। तो ये हमको बड़ा सही लगता था, फिर हम इसलिए पढ़ाते भी बहुत बेसिक से हमेशा। हम लोग का पूरा आप देखो फिजिक्स वाला का हमेशा फिलॉसफी भी रहा है कि एकदम बेसिक से चलते हैं, हर बच्चे को ध्यान देते हैं। तो यहाँ पे हम लोग का राइम करता है।
So like I said, I was blessed with amazing teachers. I just want to share the knowledge to the next generation. It's a medical knowledge. It goes to the next generation. It automatically will go forever, and it will help in the healthcare of the society.
True.
So I always believe every student here, except for the 5% that's always there, who doesn't want to learn because they might have some other interest.
Right.
That's all. So that person is different. So whoever comes to us, out of 100, 90 is willing to learn. That's the reason they're sitting in a class. Otherwise, they won't sit in a class. So my duty is to make sure not to target on the 5% who's going to get the first rank. They will do their best even without me.
Right.
This 90% who needs a help, I wanted to tell them something where medicine is not just from books. It's from life. There's a big thing which is said in multiple literatures. What you put into your mouth determines how good you are. Food is medicine. We are disrupting food. That's disrupting lots of medicine things. So I want to make students understand medicine is not just about test and giving drugs. Medicine is a way of life. Once they interact, once they understand it's a way of life, they will become excellent doctors. If they can understand that, that's enough. So that's what my struggle with the students also. It's not about books, it's not about exams, it's not about MCQ, it's not about marks. Medicine is a way of life. Understand that, get into the way of life. You can guide multiple other people to lead a proper way of life. Not to treat people, to lead a proper way of life. That's what I believe, that's what my teachers imparted on me, and I wanted to do that to the future generation.
जैसे हम लोग का भी PW MedEd पूरा बना, नीट PG वाला वर्टिकल, नेक्स्ट वाला वर्टिकल जो बना, सारे टीचर्स आए, आपने मैक्सिमम टीचर्स को आपने कहीं ना कहीं से कनेक्ट किया है ना, एंड यू बिल्ड द टीम फ्रॉम स्क्रैच। आपने इस बात पे ज़्यादा ध्यान दिया कि प्रैक्टिसिंग डॉक्टर्स पढ़ाएं, ऐसा क्यों? इससे क्या फ़ायदा होता है और इसका क्या नुकसान भी हो सकता है?
See, when I say a practicing doctor is teaching a student, the books, the latest version of the books, like most of the books comes every 4 years or 5 years. They cannot print any standard book every year. It's impossible to do that. If you looked at COVID, and if you carefully looked at COVID, every week or second week, AIMS changes the guidelines. That's what medicine is. medicine changes. But for a student, I cannot put that in the form of book every second now and then. Remember, if you tell to a student, like COVID, every disease he or she is going to read changes every week, they will never read. So what practicing doctors do is, in their own specialty, they'll stay updated. So that updation, there'll be filter. I won't tell them everything what's updated. The filter happens and say that, see, this is something which an MBBS doctor also should know, not just an MD. But if a person is not practicing, is just being a teacher, this updation might not be 100%. It will be there. They'll update for sure, but 100% will not be there. So that's what a specialist is required. I can teach every subject. Everyone can teach every subject because everyone has done MBBS. The reason why I want a specialist to teach a subject is the updation, the relevance. There may be 100 topics, but it's only 2 of them an undergraduate should know. That relevance is what a practicing specialist will bring, and that's the reason we want specialists to be there. And most of them are working, most of them are practicing, so that they can impart their practical experience also. Rather than saying, see, heart goes like this, you have a heart attack here. A patient came to me with chest pain. Patient had a chest pain like experiences like an elephant standing on the top. That's how crushing it will be. Patient came to us, we did an ECG, we put the leads here and here. That makes it more interesting.
Right.
A student will also like it.
Right.
Rather than going just book based, they go experience based, they'll like it. That's the reason we feel that entire MedEd the faculty feels that they impart the knowledge what they are seeing in the real life, so that the student can connect more and they can excel more.
I can connect by that example. Wow, that's fine. Great sir, it was a great having you. अच्छी कन्वर्सेशन में हम लोग की और नेक्स्ट के बारे में, नीट पीजी के बारे में, मेडिकल लाइफ के बारे में भी कुछ बातें की. फिर से किस दिन बैठेंगे, फिर बातें करेंगे. थैंक यू सो मच सर.
Thank you. Thanks a lot. Thank you.